Welcome to the Global Health Equity Miniseries. I'm your host, Harvey Kennedy Pitt. Join us as we look at 8 public health principles that can help health systems build capacity through adaptation. Good morning, stroke afternoon. I find myself having to say that all the time because people are in different time zones. But thank you so much, Dr. Khulud, for being with us today. If you could please take a moment and introduce yourself. Let us know who we're talking to, who we're listening to, before we get into our interview today.
Yeah, absolutely. So my name is Dr. Khulud Khudur, and I'm currently located in Washington, D.C. My background, I am a board certified epidemiologist, and I have recently started my own consulting firm, Dr. Khulud Khudur LLC, which is a public health consulting firm. A little bit about my educational background. I have a doctor in public health. I have a master's in library and information science and a second master's in public health, and I have a bachelor in biobehavioral health from Penn State University.
Aha, because I see lots of letters behind your name, but we don't always know what they stand for. And I've heard some new things there that I've not heard before. So really, really interesting. So library science and also some public health there definitely is at the top of your list. So in terms of sort of where you're what you're doing right now as you're transitioning into your consulting, what have you been doing up until this point?
Absolutely. So I have collaborated with a wide range of individuals, from individuals to organization to community to government and non-government organizations. So I have collaborated with so many different individuals, including John Legend, the famous singer, and so many others. So it's just been an amazing opportunity to connect with different individuals and do work around public health and consulting, and I could definitely dive deeper into each of these individual arms and what we specifically do. Um, for example, for the individual arm, I do a lot of that one-on-one consultant. So actually, I had one of my clients, she's a pediatrician, and she was thinking about switching over to a public health, which is amazing. I mean, everyone's dream is to be a doctor, to, be deeply engaged with their patients. And she graduated from a very prestigious university, Harvard University. But after, practicing in that field as a pediatrician for a couple of years, what she noticed that, she's receiving people in the far end of their disease stage. And she was just deeply passionate to go to the root cause and to work more in prevention. So she started to transition over from that side, more to public health, more to impact greater, larger individuals, and also get them before they experience, the deep end of health. So she wanted to work on prevention. So I was helping her with that process. From a community and organizational level, sometimes I'm called upon to be a guest speaker, to speak on various topics. Actually, when COVID-19 first started, and this goes back to one of the principle, equity and access to information and effectiveness and efficiency and also social justice. I am originally from Sudan. So that being said, in America, there's so much information, whether it's signs, experts on the field, but my country was lacking behind on just the basic information of how to keep yourself safe, and things of that nature. So I was a guest speaker, and I thought it was just going to be, a one session with mostly my Sudanese community in America, but it ended up being a session of everybody tuning in, whether a bus driver driving or, a mother taking her kids to school, joining in and getting the necessary knowledge to keep herself and family safe. And I think that also comes to this global perspective. We do not live in an isolated environment. We live in a global perspective in a global world. And what happens in other country also impacts us here. So being able to be a guest speaker, providing the necessary information, was just deeply powerful. And the twist was, most of my education was in America. The twist was I had to present the presentation in Arabic. So I
I
was
was
like,
gonna
oh,
say that. Oh,
so
dear.
that added an extra level, but it also provided the ability, realizing that I do speak both Arabic and English, it provided me the opportunity to speak in my native tongue. Because when you're thinking about equity and when you're thinking about access, it's not just being able to present the information. You have to make sure that your audience is able to understand the information. You're able to break the information down and you're able to provide it in the appropriate language of your audience. Even if you're speaking the same language, you have to be able to break it down to bite size where they could understand it and not just use buzzwords and things of that nature.
Yeah, even though they sound really good, they always say it's really good to think about explaining to a 5-year-old or to your grandmother, which is, the populations that we maybe think about the least when we are communicating really complex public health messages. So you've already started to allude to some of the principles that this series is built on, which is not just in this series, but it's actually public health as a whole. Things like equity and social justice and accessibility. Now, I want to bring you back to your one sort of principle. And if there was one principle that you could say you really focus on in the work that you either have already done or you're hoping to do through your consultancy, what would that principle be?
I mean, of course, I don't like to live in isolation. I feel like everything works together.
Absolutely.
I can't say, oh, I'm just focused on equity and then forget about access or forget about social justice or forget about going to Congress and advocating in the Hill for, say, for example, affordable housing or child health or pregnancy. So I feel like everything works together, but if I have to absolutely choose one, I'll say equity. And the reason why I say equity, because as a Sudanese Muslim woman and first generation immigrant, equity is not just about the profession. It is about the work. It's a lived experience. It's about the work that I'm doing. And I have witnessed firsthand how systems are often fail to see people, especially marginalized people. And we bring so much value and diversity really lifts all of us up. It's not just, when we exclude people, we're doing a disservice to the entire larger community. So in my work, I really try to embody equity in everything that I do, from the policy perspective, from engagement, from even like sometime I will do um go to high school or college and become a guest speaker, just to have that representation for individuals to see people that look like themselves, to allow them to strive higher. It's very important. So having equity, bringing a diverse workforce together, it all adds to strengthen our voices. So if I had to choose one, I'll definitely say equity.
Brilliant. And it sounds like there's a bit of representation in there as well. You can't be what you can't see is what as the phrase goes. Now you've mentioned, children and young people, you've mentioned pregnancy, you've mentioned even some cultural groups there, some of who you might be connected to yourself. So in terms of a problem, I know that, in public health, we like to say, well, what is the problem that we're trying to solve? Because there are so many, we can sort of get carried away with trying to solve all of them, but really thinking realistically and thinking kind of smart, as it were. What would that problem be that you think you are most focused on solving through the work that you either have already done or that you're going to do through your consultancy?
Absolutely. So there are many problems that I have been working on to solve, and every day I'm discovering new problems that I'm going to solve in the future. Um, Definitely, throughout my work, I strive to eliminate health inequities, and they come in many different forms. In COVID-19, I worked specifically for my dissertation uh, looking at mental health and African Americans, comparing them to whites and looking at their mental health in that capacity. We noticed that in America, African Americans are bearing a high mortality and morbidity when it comes to just COVID-19 and bearing that burden. So working with communities, I started off with working with Baltimore City Health Department as a manager. So we have become very creative in reaching individuals that otherwise we're not unable to reach. So partnership, having a lot of great partnership with the community, going knocking on doors to educate people, to provide them information. Also, collaborating with churches, different centers, and different organization, and just becoming very creative on who our partnerships are. Because a lot of the time, when we are in public health, we try to just be so narrow and
Mm,
focus on just public health organization and partnering with them. But now, after COVID, we became very creative. Like even churches have been one of our strong supporters in some of the work that we are doing. Also, I worked with the CDC Foundation. We managed, in the past 2 years, I managed over 200 facility in their outbreak with COVID-19.
mm,
Um, but definitely, focusing on marginalized community has just been a passion of mine. And not only through public health and the work that I'm doing, such as managing the COVID-19 response, but also from another perspective as well. So I'm also in the housing board. And so we do a lot of advocacy on justice housing and things of that nature. And actually, in June, we actually have a justice housing breakfast. And with that justice housing breakfast, it's just important to hear stories, to share the work that we're doing, also to raise money for affordable housing. Because, and a lot of people, they come to me and they say, I thought you were in public health. How are you also advocating for housing? And how are these two worlds interconnected? And I try to tell them that we have to expand our mind and in our imagination of what is health, what is public health,
mm,
um, and it extends far beyond just our physical health. It's also our mental, our emotional, and also where we live. Where we live dictate the type of health that we have, dictates the type of access that we're able to have as well. So that's why I see these two worlds as living in harmony. My work that I do with public health and also my work that I do around housing and housing justice. I actually advocated in Congress multiple times um, in different issues, whether advocating to get more funding for housing and things of that nature, or advocating for just doing more research within, pregnancy and homelessness. So it's definitely amazing work. And these are just some of the problems that I'm solving surrounding my work.
Well, I have certainly been watching via LinkedIn. Obviously, we're in two completely different geographical locations, but that's the power of social media is that you get to see so what best practice looks like for other people, other practitioners who've been on similar journeys or sort of operate in similar arenas, but completely different geographical locations. And obviously, we're talking about this within a global context, which you've alluded to already, that we're really, when we're talking about public health, we're really in many ways talking about global impact. And so that guides a lot of us to the field of sort of global public health or global health even. And so we know sort of early on in the conversation we discussed sort of what sparked your interest. I know your own sort of lived experiences, obviously originally being from Sudan, which is also a very it's very multicultural, sort of country that people don't realize that there are different areas of Sudan and very differing sort of subcultures there as well, but very challenging. Not spoken about maybe as much as maybe other global challenges. And I'm wondering what you're doing to kind of, as a lived experience person from Sudan, who's then, obviously gone on this journey and, you've gone all the way to Capitol Hill to sort of advocate for some of the needs of certainly Black American populations. But I'm wondering if you're seeing any opportunities going forward to I don't want to say give back, but how you're going to link sort of places of origin, experiences, and also looking at the data and how that all ties together because it is a big issue. Whatever that issue is going to be, it's big. We know it's just not getting maybe the platform it needs to. What are some of those issues, and sort of how do you hope to connect that work?
Yeah, absolutely. So I did work with the Sudanese American Medical Association, and with the Sudanese American Medical Association, um, they one project that I was working specifically on was after females give birth, a lot of the time in certain remote areas, there's not a lot of doctors there. There's not a hospital, there's not doctors. Sometimes the hospital is miles and miles away. So we decided to train the trainer and train the midwives. So some of the work that the Sudanese American Medical Association has been doing is funding different programs to train the trainer. And actually, one of my close friends, she had the opportunity to travel to Sudan. She was also a nurse to travel to Sudan and to be in the ground and come and share her experiences. Because what end up happening a lot of the time, and especially in the remote areas, is that females, after they give birth, they have a lot of internal bleeding. So to support with that, we decided to train the midwives on best practices and things of that nature. But here in the States, we try to support funding for those programs and other programs as well. So I've been a part of the funding opportunities and to support in that capacity. And there were other staff that went on site to actually train and roll out different programs.
Oh, I bet you wish you could have gone as well, just to get the
Oh my
find a
Oh
way.
my gosh, you have no idea. I definitely want to go and actually, it's beautiful to, every aspect of a program to run effectively. You need people in every different aspect, people in the ground, and then people in the States and collaborate effectively. But if I ever have an opportunity to go back and actually touch the people
Yeah.
and do the work there, it would absolutely be wonderful and amazing because a lot of the time, especially as practitioners and researchers, sometimes we do the work and then someone else rolls out the work. And it's just beautiful to actually touch and hold the work that you're doing.
Yeah.
So,
Yes.
yeah.
Oh, I can see it on your face. I can feel the energy through our conversation that that is absolutely your goal. And I think that opportunity will definitely present itself when the time is right, as long as you're ready to do that, to do that. And there's lots of, I think certainly lots of great work happening across public health. People are building programs, they're developing strategies, they're working with partners, they are looking at funding, they are becoming specialists in data, they're publishing loads of things, they're working with creative organizations as well and groups to try and produce something new and innovating. But how can we take some of that best practice and ensure in all that we're doing that it is actually meaningful? We know that we suffer the risk, of doing loads of really great work, but it doesn't end up going anywhere, or it sits on the shelf, or it's just an output that satisfies a funder's expectations. How can we keep it meaningful or equity?
Absolutely. That is actually a very great question. I think for the work that we're doing or the equity work to be meaningful, we have to move beyond buzzwords. Because sometimes we get so locked into what word choice that we're trying to do and forget the operational aspect of it. So, to make equity at the center of what we do, not just a side note, and also investing in leadership, collaboration, tracking data, and holding people accountable and serving the community, but also being on the ground. Sometimes when we do the work, but we're not on the ground, we're not touching the individuals. It's hard for us to drive our work forward. And also staying rooted, deeply listening to the individuals that we're serving. A lot of the time, I know we design programs and we design different research and we roll out the research without even speaking to the people
Mm,
that this work is going to impact. Um, and I think it's critical to involve them not just on the end spectrum of things and saying, well, here's a program that we have designed, and here we want you to do XYZ, but engaging the community, even from the design stage.
yeah.
If we're designing research or if we're designing different program involving the key stakeholders. And a lot of the time even when we say the word key stakeholders, we forget the people that's being impacted by the work that we do. An amazing example of this, I did a fellowship with John Hopkins University, and that was my first real observation of how that can work.
Mm,
And they actually, while we were developing our research, we had to present to a board of community. who are selected, and they're just not selected for a one-time event. They're selected for a couple of years to serve on these boards, to give their voice, to ask us questions, for us to be able to explain to them our research, removing the technical jargon and really getting at the meat of what we're trying to say, and for them to give us input. And that input is absolutely critical, especially given that the history of public health in the past, with different studies on marginalized community that was very harmful, that really broke the trust of the community. So engaging the community early on, it encourages them to participate in more research. It builds the connection between the community and the researcher, a relationship that we desperately need, especially after years and years of unethical research that's been done on marginalized communities. So I think the one thing uh, that I want us to focus on is deeply engaging the community, and in the beginning stages and throughout the process, and getting feedback, and having measurable, actionable steps, just to both honor kind of like our future for hope, and also repair some of the damage that may have been done by the scientific community.
Absolutely, all of that, absolutely. And I think, and this is a perfect time in and amongst all that sea of information that you've just given us in listening to you there, to direct us to a call to action, because people might think, I mean, I want to do all 17 of the things that you've just mentioned, but I've got very little resource, I've got very little time, I have lots of restrictions within my public health environment or my community environment. And if I could just do one thing, maybe it's the most important thing. Maybe we can't even decide for those people what that will be. But what would you say a clear call to action could be to those listening to your interview today?
I think a call to action is just collaborate. Collaborate, internationally, locally, see what other people are doing. The more you collaborate, the more that you see what other people are doing, the more that you could support them. And this could help you individually as a person to say, oh, wow, well, I was not aware of X, or I wasn't aware of this. Or you could also see best practices.
Mhm.
And you could say, wow, my organization have always done this, this thing, whatever it could be, in a very specific way, but you just provide me a more effective or efficient way of doing things. And I think now more than ever, we are deeply connected. So the more we collaborate, the more effective we become, the stronger that we become as a public health world, and as a more equitable, deeply rooted in love community.
Mm.
So I think collaboration, it's always a great thing to do. And collaboration, not just within your peers or within your professional groups. And I think when we think of collaboration, the first thing that comes to mind is collaborating with like-minded individuals, or collaborating in professional environments, or collaborating with, conferences for different health environments. But I would say collaborate also with the people that you serve, and get to listen to them and listen to their story. I think that is the best action, call to action that I think I could possibly think of, is just collaboration, not just within your peer group, but also collaborating with the people that you serve, and deeply listening to their story.
I love that. It's, practice that's rooted in love. I think that might be seen as being too fluffy from someone at a strategic level, but actually, when we lay it plain, we lay it out, we think, what is the thing that really ties communities together and people together? Is I tend to say there's fear and there's love, right? Okay, and what you're saying today is, let's choose love and be rooted in that, but also to collaborate. Collaborate is an ongoing function. It's not something that is opportunistic. It doesn't say, oh, quick, we need to assemble someone quick to collaborate. It's something that's ongoing. We have ongoing relationships with the communities that we're serving, and we're learning from them, not just sort of imparting knowledge to those communities, but we are also learning as practitioners, whether lived experience or not. So I would really hate for this conversation to just fly past, and for people not to know how to get in contact with you, to follow your work, to, as you said, to look at the best practice and engage more globally in their mindset, because we've got listeners from different places, I can imagine, who will never have come across your work. Obviously, I've seen your work, but maybe others haven't. How can we get in contact?
Absolutely. There's a couple of ways to get a hold of me or get in contact with me. I do have my website, Dr. Khulud Khudur LLC. And you could also look at my blogs. That's a great way to kind of like see the work that I'm doing. Whether collaborating with the lieutenant governor that happened earlier this year, or whether having collaboration with different individuals in the health field, or some of I mentioned my housing justice work that I'm doing. It's also in my website, or collaborating with artists such as John Legend, or also collaborating with DC government individuals. That could all be found in my website. And I try the best I can. I know life does get busy. I also try to keep my LinkedIn updated with all the activity and the work that I'm doing. So you could also connect with me at LinkedIn. It's just my first name and my last name, Dr. Khulud Khudur, on LinkedIn. And my name is very unique. I have yet to find that combination with someone else's name. So you could find me in LinkedIn, or you could find me in my website as well.
Brilliant. And we will have put those on the screen for those who are watching stroke listening, and also linking that in the copy that supports all of the promo for each of the episodes within the series, including Dr. Khulud's. So, Dr. Khulud, I'm so grateful. I've been chasing you down like a racehorse, trying to get a hold of you. I know that time zones is a bit of an issue, but also, you're elbows deep in getting the work done, and that's a fantastic reason to be struggling to get a hold of somebody. So I thank you so much for being a part of this conversation in the series, and I hope this has been as meaningful to you as it has been to me. Thank you so much.
Thank you.